That's really why I'm passionate about this area in women's health, is being able to give women the opportunity to really express themselves and then provide solutions for that long term. Hi, I'm Dr. Alexandra Smith, and I'm a naturopathic doctor here at Neurvana Health. To pursue naturopathic medicine as a career, I first started when I went to see a naturopath on the recommendation of my mom, actually. I had just finished my undergrad degree and I was dealing with acne and bloating and some hormone concerns. And so I went and saw an ND, and I was blown away by the time that they took with me. We spent over an hour together in that first visit so that she could really understand all the symptoms I was dealing with, and then provided testing to dive deep into why they were happening, and then a game plan that really worked for me. And then that allowed me to understand what I wanted to do within naturopathic medicine and motivated me to go to school. I'm most passionate about helping women. I work within the women's health and women's hormone space, so that can include a lot of different menstrual cycle concerns, as well as different stages of life within your menstrual cycle history. So whether that's you have your period regularly, you're in perimenopause where things might be changing, or now you're in menopause where you no longer have a menstrual cycle. And within that, we assess hormones with women, which I'm really passionate about addressing the concerns related to that, like heavy or painful menstrual cycles, acne concerns, and then also the gastrointestinal tract. So understanding the gut microbiome, which is the balance of beneficial bacteria versus bacteria or yeasts or viruses or parasites that might be growing in your gut that shouldn't be in there, and then having solutions in order to treat that effectively. These areas matter to me because women's health has been a historically underserved area, and I'm really passionate about giving women the time and space to discuss their symptoms in detail so that you really feel heard, and then providing the testing that gives you answers around why you're feeling the way you're feeling, and then solutions for those concerns as well. As a female myself, I have undergone the feeling of not being heard or listened to, or having enough time to explain all the symptoms I might be dealing with. And so that's really why I'm passionate about this area in women's health, is being able to give women the opportunity to really express themselves and then provide solutions for that long term. So within my education journey, I first did my undergraduate degree, which was in physiology, study of the human body. I loved it. It was so interesting, and was really a stepping stone to allow me to go into naturopathic medicine. So then I pursued that 4-year degree, and that was fantastic. And then after you get that kind of base knowledge within the training of becoming a naturopathic doctor, when you've decided to focus a practice in a certain area, a lot of the continuing education becomes related to that area. So one thing that comes to mind is a conference that I went to for women's health and hormones down in Scottsdale, Arizona, where there were practitioners from many different fields of medicine that all came together and were talking about the research around different concerns that women may have within their hormone pictures, as well as solutions for it. And it was just really inspiring to see so many different practitioners in this area that were really kind of furthering their education to be able to treat these effectively. And then the techniques and treatments and testing that I learned within that conference, I still use many times a week and to this day. So what a new patient can expect when working with me is coming in for a comprehensive intake, which is a 90-minute appointment where we do a deep dive into your health history. We figure out what further testing we need to look at, and then we come up with a game plan moving forward. Based on that testing that's initially recommended. Once we have the results back from that testing, another appointment is scheduled, which is usually a follow-up appointment that can vary anywhere from 30 minutes to an hour, depending on how much we have to go over. But we do a deep dive where we go through the test results together, explain them in detail, and then come up with a game plan within supplements, diet, and lifestyle factors to help support resolution of the concerns that might be happening. And then within the supplement plan, my goal is never to put people on supplements and just leave them on them forever or long term. It's really about when our bodies are out of balance, we want to figure out why. We want to help steer the body back into balance, which comes with supplementation, diet, lifestyle factors, and then we allow diet, lifestyle to take over long term. So timeline for solutions and supplementation to see progress, we usually need anywhere from 4 to 6 weeks to see initial progress or symptom mitigation. Generally with hormones, we need about 3 to 6 months, sometimes up to 12 months in order to balance those appropriately and really see resolution of the symptom picture that a patient might be dealing with. For gut health concerns, it's usually about a 3-month process where we see benefit within the first 4 to 6 weeks, and then again, that resolution within 3 months. I wish more people understood how much education goes into becoming naturopathic doctors. To become a naturopathic doctor, you do have to undergo an undergraduate degree. You have to have some science-based courses within that. So biochemistry, chemistry, biology, math, physics, all have to be within that undergraduate level of training. And then you go under a 4-year doctorate program. That's very intensive. The first 2 years are the biomedical sciences, where we learn all of the pathologies and symptomatology associated with different conditions. And then the next 2 years are more clinical based, where we work with patients in a clinical setting with a naturopathic doctor supervising. And you learn more of the naturopathic modalities or treatment methods for those conditions in conjunction with medications or conventional medicine type of therapies. So we learn those therapies, and then we learn how we can support on our end as well. So it's very well-rounded training and takes a long time to go through. So all of us are generally passionate about what we've done, because to undergo the journey of education to become a naturopathic doctor is a big one. So many things bring me joy outside of the clinic, but most of it is associated with moving in the mountains in some form or fashion. So my partner and I, we do a lot of gravel biking, trail running. In the winter, we do cross-country skiing and backcountry skiing. So some form of movement out in the mountains is really my happy place and where I kind of reset for the following week. I also am quite a passionate gardener. So I have a big vegetable garden at my home where I plant all kinds of different things. And it's always fun to see the changes that happen year to year based on the weather and planting and seeds starting. And I just love kind of learning each year how I can optimize it and make it better. I think the thing that people don't expect to learn is I'm an avid fly fisher as well. So another way that I spend time in the mountains is on the rivers and fishing mostly for trout. And I love it. It's very calm. It's a reset that isn't as intense as all of my other activities. So it kind of allows for that physical relaxation as well, which it's a beautiful sport, and I just have so much more understanding and passion for the rivers and watersheds that we have in the Alberta region as a result of it. One piece of health advice: go outside. Get outside, get some sunshine on your face. And whether it's just standing outside or going and moving your body, I think that is the most important thing that we can do, and something that We don't do as often, especially in the winter in a climate like we have in Calgary. But if you can bundle up, get your coat on, put a toque on, and go outside for at least 10 minutes every single day, if not longer, that is so, so beneficial for your nervous system, for movement, if you're doing it for exercise, beneficial for cardiovascular system, for your hormones, for your gut. There are so many benefits to getting outside and getting some light exposure. And I think it's something that a lot of us miss out on, especially in the winter months in Calgary, as well as just a lot of us working professionally. We're all working inside, and so we miss out on that sun exposure. So the more you can get outside and kind of focus on some light exposure, the better, and it's free.